Hello, friends. It's Carla, your online doctor, with today's Live in 5. Today is Friday. It is August 7th at 5 p.m. So, still getting used to these glasses. Also, yesterday, Facebook and I did not get along well. So, my live is on my page, and it's now available for you guys to see, but not getting into the details. But nobody could see it when I went live. So it was a party, just me and myself. Anyway, here we are today, and we're going to continue our talk. Again, I wanted to just reiterate yesterday, or from Wednesday, the very controversial topic about the censorship and hydroxychloroquine. Thank you all for those who have kept conversations civil and reasonable and friendly, because I'd like my page to stay just that. I don't want arguments. I don't want debate. I don't want to have to delete comments, and I certainly don't want to have to block people. I did block one person from Wednesday who got personal and nasty with me. Not even somebody I remember from school years ago. So I don't like doing that. Anyway, so as businesses and groups decide between gathering or not gathering, many are doing symptom checks, screenings, okay, in hopes of reducing exposure to COVID-19. They ask, have you been exposed to anyone who has COVID-19? Do you have symptoms? Okay, all reasonable. The CDC recommends non-contact temperature checks. So now before I play tennis or get a manicure, or when I picked up my glasses, I get my temperature checked and documented on a piece of paper to say that they did it. Yet in one study of almost 6,000 hospitalized patients with COVID-19, only 31% of the patients had fever. Okay, so screen checks are only going to pick up 1/3 of the people who are infected, and of course, that doesn't include anybody who is asymptomatic, of course. Experts are suggesting adding other screening measures to pick up more people at risk, and that makes sense. So what are they proposing? They're proposing smell checks. They're not going to smell you. They're going to have you smell things. Now, as you can have fever for many reasons besides COVID-19, there is a growing body of evidence suggesting a higher rate of smell and taste dysfunction in people who have developed the infection. A study back in April on 77,000 plus patients found over 2,300 were positive for the virus. They analyzed symptoms associated with the infection and found those who tested positive were 27 times more likely to have smell and taste dysfunction than those who tested negative. Now, this was significantly higher than any other symptom analyzed. Fever and chills was number 2, but with only 2.6 times greater likelihood in people who were positive over people who are negative. Now, a review of the literature was conducted to include 24 studies from 8,400 plus lab confirmed positive patients across 13 countries. So they're trying to get a good representation of people. Smell and taste dysfunction was found in 40% of the population. Now, interestingly, one of the symptoms of zinc deficiency is the loss of sense of smell. We know the body uses zinc intracellularly to stop viral replication and slow or stop a viral infection. So could it be that individuals who get more zinc into their cells to slow an infection demonstrate symptoms of zinc insufficiency as their body uses up the element to fight the virus? An at-home test I have seen multiple times on my emails and on sites that I follow. When I was searching about this zinc deficiency, this is not an FDA-approved test, but it can be done at home and it's pretty easy. So I'm not going to guarantee your results or any accuracy, but maybe give it a try. So you take 5 milligrams of zinc sulfate and you put it in water at room temperature. Then you put 2 tablespoons of the solution in your mouth and hold it in your mouth. Don't swallow it. If you immediately have a bad taste in your mouth, because zinc tastes pretty gross, your zinc level is fine. Then it grades down to all the way from there down to a grade 4, which is no taste at all, suggesting a severe zinc deficiency. So somewhere in between. Now, I have tried this, and actually, my daughter tried it by accident. I had asked her to take a supplement that was an orally dissolving supplement. It's our vitamin D supplement. And I had also put in a little bowl, a half of a zinc. It's 25 milligrams of zinc. And she confused the two and was sucking on the zinc tablet. And she was really mad at me. So I know her zinc levels are fine. Anyway. So just something to consider if you do take supplements or you do or don't take zinc, something to try to see if, again, at home test, not guaranteeing accuracy, but kind of simple to do, right? So back to the smell test. Some places may start using scratch and sniff cards. You guys remember those? Okay, so asking you to identify a scent. Now, I guess stop and smell the roses will take on a whole new meaning. Now, it's interesting because starting about a week ago, I started developing congestion. And I was like getting a little bit nervous. Was I infected? It was raining here in Florida. I have allergies to something out in the trees. Worse when I go to certain tennis courts where the trees are there. And of course, no fever, no cough, no anything else, just the congestion. I did have itchy eyes, a little runny, watery eyes. I'm like, this is allergies. But every day I would take out my essential oils. I would take out my lavender or whatever. Like, okay, I can smell them. I'm good. So I was doing my own at-home smell test. So if you're the type of person, my daughter loses her sense of smell and taste anytime she gets an upper respiratory infection. So it may have something to do with that zinc going on there. So you may want to start supplementing if you ever feel like you're losing your sense of smell or just in general right now. So that's what I have for you. You may be getting temperature checks and smell checks. Again, they're not smelling you, you're smelling something. On that note, it's Friday. I hope you're had a wonderful week. Have fun things planned this weekend. Again, stay safe, social distance, do all the good things. And I will see you again on Monday for another Live in 5.